Hello, welcome to episode 118 of the Inside Knowledge podcast for people with IBS. I'm Anna Mapson. I'm recording this in March 2026, and March is Endometriosis Awareness Month. So I thought I'd take this prompt, this sort of opportunity to talk to you about this condition if you're someone who has IBS or SIBO. And this is because there is a bit of an overlap in terms of symptoms. A lot of people with endometriosis also have gut health issues and digestive problems. Plus, both these conditions are tricky to treat. When you have a diagnosis of endometriosis or IBS, there's not a clear treatment path for either of them that says, right, this is exactly what you must do, because it does very much depend on your symptoms. So it's a little bit unknown, but what we do know is that there is a big overlap in people who have endometriosis and people who have IBS. So today I want to explain to you a little bit about diets, things that might be able to help, but also some of the ways that the similarities could be manifesting themselves in your body, or what might be driving some of the symptoms. Because with hormonal conditions and with digestive conditions, both sides of this coin, we do have a lot of different presentations. You know, it's not clear when someone says, I've got IBS, what your symptoms will be compared to somebody else. And I think that can be very much the same with endometriosis as well. If you're listening to this podcast, it's normally because you've got IBS or SIBO and gut health issues. So you might not be that familiar with what endometriosis actually is. It's surprisingly common as well. I think up to 1 in 10 women may have some experience of endometriosis throughout their reproductive years. So similar to IBS in terms of the amount of people who have it. It can be really debilitating, really difficult to manage. And depending on which study you look at, the odds of having irritable bowel syndrome alongside endometriosis range from about twice as likely or 3 times as more likely to get IBS if you've got endometriosis. And in terms of out of that pool of people who already have endometriosis, it's about 1 in 5, like maybe even 1 in 4 have got some sort of IBS. Now, it's less clear, like what type of IBS you will have, and that will come on to in a little bit, depending on where the endometriosis is. That may affect what kind of digestive problems that you're getting. Because this is the thing about endometriosis. It's not just about the pelvic cavity. It can affect anywhere in the whole of your digestive tract. You can even get endometriosis in your mouth. One of the reasons it's so varied and so painful is that these cells that are part of the endometrium, like part of the lining of the womb, they're growing in and around other organs, like I said, even up to your mouth. It could be along the bowel, could be along the lining of your pelvis, it could be in the vagina, vulva, anywhere in the bladder or the urinary tract system. So many places that could be causing pain. And the reason it causes pain is because they behave like they're inside the womb. So they start thickening throughout the menstrual cycle, they start breaking down, they start bleeding and causing inflammation and irritating like the immune system, the nervous system, and all of that happening all around the body. So what else can happen is you get these endometrial tissues creating adhesions. So that is where the lining of each organ and our intestines starts to stick together. And these adhesions can also have a dramatic impact on your body's ability to process food through the gut, because the stickiness makes it harder to go through, harder to pass through the passages of the intestines. Like with some other conditions, such as celiac disease, inflammatory bowel disease, endometriosis can take a really long time to diagnose, and often women don't get diagnosed until they're later in their life, like maybe approaching 40s. It tends to be around this time that women get diagnosed, but obviously they can have it for a lot longer, for years and years, but only it's that point in kind of towards midlife where it's starting to get diagnosed. So a lot of women with endometriosis have been treated for IBS for a number of years, in the same way that people with celiac disease or microscopic colitis also have often been treated for IBS by doctors and various health professionals before they get another diagnosis, which is really what the underlying cause of their problems are. So now we've understood a little bit more about, what it is, what we're looking at. It's this endometrial tissue moving through the body, creating pain, causing some problems. And in terms of a cause, again, it's really hard to see why do some women get it and others don't. But some risk factors can include genetics. It runs in your family, especially if you started your periods quite early. And again, that often runs in the family, like before age 11. Maybe if you are in a very low body weight is also a risk factor for getting endometriosis. And any hormone disruption like elevated estrogen, that what causes that? Almost like we need to go back up the chain, the same as we do with digestive issues. So how would you know if endometriosis is what you're suffering with instead of IBS? If you've never been to the doctor about it, this is a first place you would start to go and get some investigations. So the things that they would be looking for if somebody is wanting to diagnose you, the sort of symptoms they would be looking out for would be, firstly, it's pain, and pain in all kinds of situations. Very painful periods, often very heavy bleeding on a regular basis. Maybe you've lost a lot of blood every single month for years. Pain during and after sex, pain even around ovulation, depending on where that endometrial tissue is embedded, pain around your lower back, your legs, like often that's different to a sort of IBS crampy pain because it's more around the lower part, like the whole pelvic basket, right down into the vagina, vulva, and all around your lower back into your hips. That can be very, very sore, as well as digestive issues that you might be more familiar with for IBS, like nausea, fatigue, diarrhea, constipation. And you're noticing a pattern around your digestive symptoms and your menstrual cycle. Now, like I said, this sometimes happens into midlife. That can sometimes occur at the same time that you're getting a more irregular cycle. So it could be maybe more difficult to try and track these changes because you're looking for changes in a regular cycle. But if you don't have a regular cycle, that can be even more challenging. The signs that people often get is called on social media endo belly. It's like a real low down bloating that may come and go throughout your menstrual cycle, maybe at particular times of the month. But this kind of cyclical bloating that is not constantly there, but you might feel bloated after everything you eat, and that might be more of an IBS issue. But then you get this additional bloating around your period or even ovulation as well. So this is about the hormonal fluctuations triggering additional bloating, and it's often quite low down bloating around your hips. So the way that endometriosis can affect your digestion is, like I said, you get these endometrial growths, so growth of its lining of the womb in the bowel. So often this is around the rectum or the colon and sort of that lower part of your digestive tract, but it can be anywhere. It could be higher up as well. It can cause a lot of sensitivity and pain. You may find you're getting more constipation, but alternatively, you may find you're getting more diarrhea. And this might be down to the hormonal fluctuations throughout the month. So as you ovulate, say you get a spike of estrogen, that might then trigger different bowel symptoms. You might also get a sort of stabbing, shooting pains in the anus or rectal area. And that might be something that you would include in your conversation with your doctor. And also, if you're experiencing a lot of blood as well, blood in the stools, blood in when you're wiping, that would be something, again, to really speak to your doctor about and mention, because if it's not just the period bleeding, you want to make sure that any other digestive tract bleeding has been checked out by a doctor. So I mentioned as well about that, those adhesions maybe slowing down your gut transit time. And we know that adhesions are a risk factor for small intestine bacterial overgrowth, or SIBO. So as the digestive tract motility slows down, there is more potential for you to get an overgrowth of microbes, which can be then triggering additional fermentation, gas production, and a whole range of other symptoms about the digestive tract. I worked with one client a while ago who came to me with constipation. She was really struggling to eat any fiber. She was struggling with energy and feeling very fatigued. She had quite a physical job where she was constantly on her feet and moving around a lot throughout the day. So we did a lot of work on her diet, like really sorting out the constipation. So she was getting more regular bowel movements. But the one thing that we just couldn't solve throughout the 3 months of working together was that her pain seemed to come and go. And it was a lot better when she wasn't constipated. And then over the next few months, when we had a bit of a break from working together, she had some investigations with her doctor, and they found eventually that she did have endometriosis, diagnosed her with that. We then worked together again for another few months, and as part of that, really focusing on avoiding constipation, because if you are very sore, everything's hurting, the last thing you want to be in that whole torso is impacted with hard stool, creating more gas buildup. So when you're constipated, it's harder for the gas to get out, so you feel more trapped gas. Again, that's pushing. And if it's pushing against areas, and they sometimes call them lesions of endometriosis, that are triggering the nervous system, putting your body on high alert, the last thing you want is to be, triggering that through issues with your digestion. So it's really challenging. And to the extent that the person I worked with, was unable to work because it was so painful. And the symptoms were so bad at certain times of the month. One of the things we did with this client was to go through the low FODMAP diet to try and remove some of the fermentable or like gas producing foods that could have been triggering the symptoms, because again, like, not only do you want to keep the regular bowel movements, keep things moving, but also you want to avoid additional water being pulled in, like any additional digestive swelling, because that can also be triggering a lot of nerve pain. And we know that there may be a connection between mast cells triggering nerve pain in IBS, but also in endometriosis as well. So the low FODMAP diet can be a particular type of intervention where you're removing a lot of fermentable fibers, which then allow you to test out if certain foods are a trigger for you or not. If you have endometriosis, you don't need to avoid all high FODMAP foods forever. That would be silly, because you're missing out on a lot of good nutrition and fiber and fermentable fiber. So we only want to identify the types of foods that could be triggering your issues. So the low FODMAP diet may help you do that. And it has some use in endometriosis. It has been tested and used, and just partly because of the control of the digestive symptoms that it may give. Now, it doesn't help everyone, even with IBS, let alone everyone with endometriosis. So it may not be a cure-all, and it's certainly not a diet that you should be following long-term. So you would remove things for 2 to 6 weeks and then carefully reintroduce them. For example, onions may be a trigger, something that you find increases your bloating, it makes you feel worse. So therefore, you might want to avoid onions, but you will only know that if you remove all the FODMAP foods and then carefully bring them back in one by one. And that is a slow and careful process that will help you identify as many foods that you can bring back in as possible. So that is one dietary intervention that you could possibly try if you have endometriosis. The reason we want to get back to a high fiber diet, though, is because certain gut bacteria can influence levels of estrogen through something called the estrobolome. It's like a cross between estrogen and microbiome. Estrobolome. All right. So these are bacteria which can influence the levels of estrogen circulating in the blood. And they do this by breaking bacteria away from a water-soluble carrier in the gut. When we finish with estrogen, it goes to your liver, then it gets broken down into a small component and attached to a water-soluble molecule that can help excrete it from the body, take it to the bowel, and it can go out in the poo. Now, if your gut has high levels of bacteria which produce a certain enzyme called beta-glucuronidase, or you're constipated and that food waste is sitting there for several days, that again allows a normal amount of bacterial production of beta-glucuronidase to do a lot more work, or you've got high levels of bacteria that are doing a lot of this work, that means certain levels of estrogen can escape back into your bloodstream. They're getting reabsorbed back into the body and affecting the endometrial cells that are all around your body. So that's going to increase the pain. It's going to increase that sensitivity and cramping and nerve reactions that can be so key in endometriosis. It's a really, really tough condition, partly because there is a lack of understanding and a lack of a kind of treatment plan, the same as a lot of people with IBS or SIBO. It doesn't necessarily always mean that you know what to do once you've got a diagnosis of it. Another key element you might want to think about in terms of diet is reducing inflammation. Now, you might have heard me talk before about anti-inflammatory diets and what does this even really mean? I don't really like the term anti-inflammatory diets too much because there are some things that we can control through diet, but it's more like dietary profile. So taking, for example, something like the Mediterranean diet, which is rich in omega-6 and omega-3 fatty acids, lots of plant-based fibers, vegetables, whole grains, and oily fish, lean meats. This is a good, healthy diet that most people will get on well with. What we're moving away from when we talk about anti-inflammatory diets is high processed, ultra processed products, lack of fiber, high saturated fats from things like baked goods, maybe fatty meats, burgers, chips, those kind of things as well. Will all be adding to an inflammatory profile. So there is not one food that is inflammatory that you should avoid. That doesn't make sense and is not valid. So there's not a certain food, and you might hear people talk about seed oils or dairy or gluten, that these are inflammatory, and it is not true. You can eat all of those as part of a healthy dietary profile. We're more looking at where foods sit within the context of everything else that you're eating. It's okay to have sugary treats sometimes. It's okay to have these things if you're also eating lots of vegetables and fruits. That is an anti-inflammatory diet, despite it containing sometimes chocolate, sometimes you have an ice cream. Anti-inflammatory diet doesn't mean foods individually are inflammatory or not. It's about the context of your diet. And critically, it's about fiber. Fiber feeds these good bacteria, which can crowd out some of those bacteria that I just mentioned that are producing that enzyme beta-glucuronidase. It's also certain bacteria are more likely to trigger inflammatory processes in the body. There's something called LPS, which is a short name for lipopolysaccharides, and these come from gram-negative bacteria, which, most of us have in our gut bacteria, but when there are a lot of them, or when somehow they are getting into our bloodstream, can alert the immune system, putting it on high alert and just increasing some inflammatory cascades. That in turn can then sensitize you even more to things like pain and also to this hormonal cycle. So we have a link between the gut bacteria, hormones, as well as your digestive processes. So what I mean by that is like estrogen, for example, high levels of estrogen can not only affect things like give you sore breasts and heavy periods and maybe spots on your face around your period, but also it can affect the production of bile, and which is an antimicrobial molecule helping to keep the small intestine clean, but also helping you digest your fats. So if your bile is sludgy and thick, which can happen when you have high levels of estrogen, then maybe you're reacting to high fatty meals. Maybe you're also reacting to high fiber meals because you have got bacteria that don't well break down fiber. So there's a real connection between hormones, gut, and digestive function, and they all kind of influencing each other. So where you are doing things like the low FODMAP diet, we need to get back to good prebiotic fiber-led foods because they help to regulate your gut over time, and regulating your gut can sometimes have a knock-on impact on endometriosis. So the key nutrient I want to bring out as well in talking about anti-inflammatory molecules is omega-3. This you will find in foods like in oily fish, such as mackerel, salmon, herring, Anchovies. These are great sources of omega-3, and this is an anti-inflammatory molecule that may help to calm the inflammatory cascade. Also very good for brain health, for mood, for stressful situations and anxiety. So yeah, again, like a really good all-rounder. And in some studies, they've shown that the people who had the highest quintile, that's like if you split everybody into 5 groups, people in the top 5th category were 23% less likely to get endometriosis than those who had the lowest intake. And they were eating about double the amount of omega-3 as the people in the lowest. So if you split people into 5 different categories, the ones who were at the top eating the most omega-3 had the least chance of getting endometriosis. It's definitely worth considering. It may not be suitable for you if you take medication or if you have other health conditions, so please do consult your doctor, any other nutrition professional if you are interested to see whether it's right for you. But consider eating oily fish if that's an option for you. You can also get vegan omega-3, which is from seaweed, and can come in a gelatin-free capsule suitable for people on a plant-based diet or vegan. So those are 2 things that you could think about. So fiber, omega-3s, trialing the low FODMAP diet, an anti-inflammatory pattern. If you have endometriosis, the treatment options range from surgery to remove some of the adhesions, remove the lesions that might be creating the biggest parts of pain, the areas with the most sensitivity. So that's one option. Another option is to take the oral contraceptive pill, go on the pill, which can regulate your hormones and stop some of the spikes of hormones that may be driving the highest amounts of pain at certain times of the month. And these are conversations that you obviously would have with your doctor about what is right for you. The dietary changes are really only about managing the symptoms and are not going to cure endometriosis, but may help you live a better life with the most enjoyment that you can throughout this really difficult time. So if you're someone who has both IBS and endometriosis, then try and remember those things that maybe are helpful about the anti-inflammatory diets, lots of fruits and vegetables, whole grains, oily fish, that more Mediterranean style of eating, and see where you can move towards that pattern, because that has been shown to be very helpful in lowering inflammation and supporting healthy bowel. And I will leave it there for this week. So for Endometriosis Awareness Month, thank you for listening to this episode of the Inside Knowledge podcast. Better digestion for everyone.